Hello dear learners, I welcome you all to the today's topic on analeptics. They are also called as CNS stimulant. In this video, we are going to talk about the repeatedly asked questions which are asked in the board exam, and they are important from the theory examination point of view. So, coming towards the first slide, this contains repeatedly asked questions on analeptics. So first question says define analeptics. So as usual, you are supposed to define the analeptics along with the definition as we have done it for the earlier chapters. Then along with it, the combined question is there. Give the structure and chemical name of caffeine. So caffeine, as we have seen in the classification, it is amongst the most important and the complete drug you are supposed to do for the caffeine, and it belongs to the class natural, which is obtained from the natural source. That is, they are also known as methyl xanthines. That means methyl derivatives of xanthines. So we are supposed to give the structure of it along with the chemical name. So definition carries 1 mark, structure carries 1 mark, chemical name carries 1 mark, and total question carries 3 marks. Then coming towards the next question says what are CNS stimulants? So now, as we used to do in the earlier chapters, if the question is being asked, like for example, what is malaria? So we used to write the malaria definition along with the symptoms of malaria. So here it's not about a particular disease, it is about the category. What are CNS stimulants? So we will write down the definition along with the example, and we will write down the general uses of CNS stimulants, in which conditions they are used. So this what are CNS stimulant kind of question is asked for 2 marks. Then discuss their uses or is also asked for the 2 marks. So the answer is one and the same. Now discuss the uses means you are supposed to elaborate on the condition on which the CNS stimulants are working, and draw the structure of coramine. This carries 1 mark. Now structure of coramine. Coramine is also known as nicotinamide, which is a synthetic derivative. So nicotinamide or coramine is one and the same. So this total question carries 4 marks. Then question 3, if you look into the question 3, write the structure, properties and uses of caffeine. So this way this complete caffeine is important. Structure, properties and uses of caffeine. 1 mark each. Structure carries 1 mark, properties carries 1 mark, and uses carry 1 mark. So total question carries 3 marks. Then this is a really very important question from the exam point of view. Define analeptic, which we have seen earlier in the question number 1, and name an analeptic which is used, which is a xanthine derivative. Xanthine derivative, as we all know, it is a caffeine, and a pyridine derivative, as we all know, it is nothing but nicotinamide. So pyridine derivative is nothing but nicotinamide. It is also known as coramine. So xanthine and pyridine derivatives they have asked. So it is nothing but the same answer you are supposed to write. Xanthine derivative is nothing but caffeine, and pyridine derivative is nothing but nicotinamide. Then also you are supposed to write the structure with the chemical names. So chemical names also you are supposed to write. So writing down the structure of caffeine will carry 1 mark, and writing down the chemical name will carry 1 mark. Drawing the structure of nicotinamide will carry 1 mark, and chemical name will carry 1 mark. So this way this one question will carry 2 marks each, and the total is 4 marks. Then question number 5 says write the structure of following. So here the IUPAC name is given. We are supposed to write the name of that drug. So the IUPAC is N-diethyl pyridine 3-carboxamide. So since it is pyridine, and the pyridine derivative we have seen in earlier question, it is nicotinamide. So it is nicotinamide or coramine. Then next question number 6. Give the structure, chemical name, physical properties and uses of nicotinamide. So same as we have seen in the caffeine for the caffeine part. So the same applies to the nicotinamide also. Structure, chemical name, physical properties and uses of nicotinamide or chloramine. So each point carries 1 mark and the total question carries 4 marks. So since there are only 6 questions, from this you might have understood that this is the very small chapter of your syllabus. So we will go to the summary now. So from the questions you might have understood that definition is important of that of CNS stimulant, या फिर what are CNS stimulants. Then complete drugs which are important are two. First is caffeine and second is chloramine, which is also known as nicotinamide. Then structure with chemical name, two structures are important as far as this chapter is concerned. So one is caffeine, which is nothing but a xanthine derivative, and other is nicotinamide, which is nothing but a pyridine derivative. So if the generalized question is asked in the exam, draw the structure of drug containing pyridine derivative. So as far as till now whatever the topics we have covered, so it is INH also and nicotinamide also. So whatever you prefer you can write down if the generalized statement is there that draw the structure of drug containing pyridine ring. And if specifically they are asking you draw the structure of any one anti-tubercular drug which is a pyridine derivative, then you are supposed to mention INH. And if they are asking you an analeptic containing pyridine derivative, then it is obviously nicotinamide. Then xanthine derivative is caffeine. So they may ask you xanthine derivative also, or they may straightforward they will ask you caffeine also. So with this we summarize that caffeine and nicotinamide both are really very important as far as this chapter is concerned. Classification is least important because it is not only asked in the exam. Then these synonyms, this is the very important thing that you should remember the synonyms. What all synonyms are there in this chapter? Like very first starts with the name of the chapter, that analeptics or CNS stimulants. That means analeptics are nothing but CNS stimulants and CNS stimulants are nothing but analeptics. Same way, nicotinamide is nothing but chloramine and chloramine is nothing but nicotinamide. So these things you will have to remember. Unless and until you don't remember these things, you will not be able to write the answer, though you might be knowing the answer. So with this we finish with the repeatedly asked questions. I thank you all for patient listening and I hope you will make a good use of this for your studies. Thank you.